Hi, my name is Gary Freed. I'm a pediatrician here at the University of Michigan and the director of the Program for Equity in Adolescent and Child Health. And I'd like to let my colleague introduce herself.
Hi, my name is Susan Woolford. I'm a general pediatrician and health services researcher here at the University of Michigan, working with Gary as the associate director for the PEACH program. And it's my pleasure to be able to share about the program today. So when we talk about the PEACH program, we like to start by sharing some definitions. And to be clear, it's not that we think we own these definitions or that these are the only definitions. It's just so that as we have these conversations, that we'll all be on the same page about what we mean. And so to start off with when we talk about health disparities, we're talking about a difference in outcome that's associated with one or more social determinants of health. So for example, if we think about children living near factories, they're at increased risk of having respiratory illnesses and decreased lung function. And as we all know, factories are not placed randomly within our communities, but tend to be placed in areas with lower income families. And so this contributes to the health disparities that emerge. Another example here is that of Black infants who have a higher risk of infant mortality compared to white infants, due in part to systemic racism, poor housing, and poor nutrition. Now, while all of those are very important, and we think that there's lots of value in studying those issues, where we want to focus is on health inequities. And when we speak about health inequities, we're speaking about differences in clinical treatment or patient experiences related to race and ethnicity, income gradient, gender and sexual orientation, language, ability status, body weight status, all of these types of factors that might lead to differences in the way in which children are treated. Now, for example, we might ask, do children in wheelchairs get the same physical exam as other children? We don't know, but we think these are the kinds of questions we'd like to address. It's important to note that we do not think that the differences in treatment that may exist are due to people being evil. We absolutely do not think that. We believe that these occur due in large part to unconscious bias. And we all have unconscious biases. We have to have cognitive shortcuts to enable us to get things done. And when we have these cognitive shortcuts, they often lead to having unconscious bias. And they don't go away with reading a blog or going to an hour class. These unconscious biases stay there. We all have them, and they're very, very hard to change. With that in mind, we want to think about how we can improve care and promote equity in the face of the presence of unconscious bias. Now, one way we think that we can conceptualize this is by looking at the way in which we deal with safety in healthcare systems. And safety presents a good model for thinking about how we can improve health equity. In the culture of patient safety, we focus on systems and processes rather than on the individual. And there's some key safety characteristics that we think are relevant. So for example, we understand that humans are all fallible and that we should have a mindset for process improvement and engage in transparent measurement. And we see this really well when we consider a common example, such as hand hygiene. So to reduce preventable infections, we, in addition to education, which is really important, we put in place protocols and structural changes that help improve outcomes. And it makes the easiest thing to do the right thing to do. So, for example, we put hand sanitizer dispensers outside of every patient room to make it easier to engage in the hand hygiene. So with this, we think we can use those concepts to help us think about pediatric health equity. And you might ask, why pediatric health equity and not focus on adults? Well, there are a few reasons we'd like to share. First of all, data on variation in care by ability status, income gradient, race and ethnicity, language, gender identity, and all the many factors that we've mentioned, a lot of it already exists when we think about adult care. However, in pediatrics, we have very little data in this arena. And there are many reasons why this is likely to be the case, but a few we'd like to emphasize. First of all, it is particularly difficult to do this work in pediatrics. With adults, for example, we can use actors. We can send in a woman with chest pain and a man with chest pain, and we can see whether or not they're treated differently. With children, 3-year-olds, really poor actors. So it's very hard to use the same methods, and we have to come up with novel ways of addressing these issues and finding answers to these questions. Furthermore, when we think about whether or not we treat patients differently, we're somehow able to consider that that might be the case for adults, but there's significant cognitive dissonance with the idea that we would ever treat children differently. However, in both spaces, both in adult care and in pediatrics, we think that the potential for an impact of programs that address health equity is high. So with that, the mission for PEACH is to improve the equity in the delivery of care to children and adolescents. And specifically, our program objectives are to examine and to address potential inequities in the care of children and adolescents at Michigan Medicine. And because we do not think that this is just an issue that occurs at Michigan Medicine, we'd also like to impact care at other health systems and at the state level and national levels as well. So to achieve this, we think about it in 3 steps. First, we'd like to assess potential areas of inequity, then design and implement programs that will reduce or eliminate any inequities that are identified. And finally, to evaluate the impact of those interventions. To achieve this, we have partnered with 10 different departments and units across Michigan Medicine, and we have representatives from each of these departments and units that serve on our advisory committee, and all of these entities have invested in PEACH, along with CS Mott Hospital, which allows us to also work with nursing and with social work and child life. And then the Office of Health Equity and Inclusion have invested. And then beyond Michigan Medicine, we have other partners, including Poverty Solution, the Michigan Institute for Data Science, and Precision Health. And so you might wonder what sorts of questions all of these groups are interested in answering. Well, so just to present a few examples of questions that have been raised, we wonder, for example, is the time to organ transplantation the same for low-income families as for others? Do we assess pain differently by gender or by race? Now, we know there are differences in the way pain is assessed with adults, but we don't know. With children, are there differences by gender and by race? Does the quality of patient education differ by language preference? And do we treat children differently when families cannot be at the bedside? And we know whether or not a family can be at the bedside depends on the flexibility of their job or whether they have childcare for other children at home. So we wonder, are there areas in care where you think inequities may exist? If so, then PEACH is for you. And it's for you whether or not you have experience in research or QI studies. We want PEACH to be able to work with and help people wherever they fall on the spectrum of experience in these areas. But if you have important questions to ask, we want to help you answer them. And to share more about how we work to address or to identify and address these inequities, I am going to hand back over to Dr. Fareed, who is on mute.
Thanks so much, Dr. Woolford. And I know most of y'all are probably thinking, wow, this sounds really great. How do I get engaged in this? How do I work with PEACH? And so now that's what we're going to talk about. The first step in engaging with PEACH is to submit an intake form. And this can take up to 45 seconds about what's going on to be able to help us understand what the issue is that you see, where the potential inequity might be. It's very simple. It's your name, what unit you work with inside of our health system, and also in just a couple of sentences, what you think the potential inequity is. And this can be anything that you've experienced, that you've seen, that you may have heard about, that you're really wondering, is this just a one-off anecdotal experience, or is there something really systemic here? And that's what we want to help, is to be able to figure out, is there something here going on within our health system in the way in which things are done that we can work to do something about? So the next step is, after you fill in your intake form, you'd meet with what we call our project mentors and different consultants at Peach to be able to talk about that particular issue. And we can provide lots of services, including literature reviews, help with research design and research methods, and then also to be able to work on either quantitative or qualitative methods to be able to figure out in a rigorous way, is there really an inequity going on here? We then work, after we figure out how to collect those data, we then work and help out in terms of statistics and providing data analysis. We have small grant opportunities so that you could even have the ability to hire some of our staff to work on your projects for you. And then, importantly, if we do find an inequity exists, like Dr. Woolford said, we want to do something about it. And so we have quality improvement professionals on our team that can then help to plan an improvement strategy and an implementation strategy for it. And then once we have that quality improvement or improvement strategy in place, we would then test to see whether or not we really make a difference. And then we'd be able to follow up to continuously modify that improvement effort until we finally were able to do something about that inequity. And then ultimately, once we actually make that difference, we want to publicize it. We want to celebrate it with you and be able to help the people who bring forward these ideas present their results wherever they might want, whether it be at a hospital quality meeting, something within our health system, something within their professional society, or to even write up for a peer-reviewed publication. And for those who come and work with us who are experienced researchers and want research to be a significant part of their career, we can help in terms of making sure that those studies that are done with us can function as pilot studies to be able to use to apply for extramural grants, to be able to make a difference at a state level and at a national level. And we think, again, that we want to do this, not that we would take over these projects, but that we actually facilitate the ability of the people who bring forward these ideas, what we call project leads, to be able to get this done. Peach is committed to meeting project leads and people who bring forth these ideas wherever they are. Whatever support is needed to be able to help investigate and assess whether an inequity is taking place is the support that we want to provide. And then subsequently, we don't want to take on any project where we don't have the potential to make a difference, because ultimately it's not enough just to find a problem. If we find a problem, we want to do something about it. So what are the components of Peach to be able to make that happen? Like I said, we will provide you with research design and methodologic consultation. We're going to work on developing and testing new methods to study inequity, because some of the ones that are used in adults simply don't work for kids. But we believe we can be clever, and we can be inventive, and we can be rigorous, and we can figure this out. We can provide biostatistical and research project support. And then again, importantly, assistance in the development of solutions to any of the inequities that are identified. Small and medium-sized grants to faculty, and importantly, to hospital, clinic, and nursing staff as well, to be able to make sure we can accomplish these projects. And then ultimately, within the next months, we are going to work to develop a community of people who care about these issues. Right now, there's not an opportunity for people who want to engage and work together on child health equity issues to be able to find each other and to be able to, like I said, to work together, learn from each other and support each other. So we're going to be having invited speakers. We're going to start a seminar series, work in progress sessions, and a journal club to be able to, again, to facilitate a community who's interested in these issues to be able to form, come together, and support each other. So now you're thinking, wow, this sounds great. How do I get started? Again, the first step in getting started is to be able to fill out one of those intake forms. And the intake forms are available. There we go. The intake forms are available either by this QR code you see here on the left of your screen, through our website, www.peachequity.org, or you can write to peachcoms@umich.edu, or even write directly to myself, Gary Freed, or to Susan Woolford to be able to help you get started. And we want to have more people reach out and join the cause and say that they were brave enough to look. Some of this is really touchy stuff, but it's important that we take on these important challenges and sometimes these uncomfortable challenges to be able to truly make a difference in the lives of children and their families. We are a small but growing team. We have now almost 15 people on our team, ranging from faculty mentors to administrative personnel, to qualitative and quantitative research experts, quality improvement experts, and a variety of different people that are here to help you make a difference. And we hope to hear from you soon and look forward to making a difference in child health equity together. Thanks for taking the time, and we hope to hear from you soon.